Hi, everybody. Robin Jones here, Chair of ROMA, and I just wanted to take a moment to debrief the conference with you. This year, 1,900 people attended the conference, and the exhibit hall was sold out with 85 exhibitors. We know that there were hundreds of meetings between you, other municipal elected officials, and provincial delegates. And we also know that these meetings are important for you because it allows you to keep your concerns front and center. Concurrent session rooms were packed, confirming for the board that we got the topics mostly right. You will recall that the sessions focused on subjects such as economic development, to housing, to municipal staff retention and recruitment, and to gender violence. We had powerful discussions on collaboration with Indigenous peoples, and yes, an important opportunity to understand voluntary public health unit mergers. We updated you on the situation that many rural municipalities are dealing with in regards to federally regulated railways and the Drainage Act. Cost sharing for these infrastructure projects has been Ontario law for more than a century. However, railways are now refusing to comply with this legislation, leaving the municipalities to pay thousands or hundreds of thousands of dollars out of their property taxes to either pay the costs or fight against these corporations. It's clearly a David versus Goliath dispute. ROMA's position is that federally regulated industries have a responsibility to pay their fair share for drainage work, and we have applied for legal intervenor status to do the heavy lifting in court for rural Ontario. We also had the opportunity to talk about our newest research paper, which is in regards to access to healthcare in rural Ontario. In particular, this research paper focused on access to healthcare services, including primary and emergency care, mental health and addiction services in rural Ontario. So here are some of the highlights from the paper. Rural is different. How? Our travel burden. In many rural areas, traveling for medical care isn't measured in minutes, it's measured in hours. Our emergency departments. There were more than 600 emergency room closures in rural Ontario in both 2022 and 2023. And we know from our ROMA survey that 65% of respondents said going to the emergency room for medical care is their only option. They don't have access to walk-in clinics, and many don't have access to primary care. So let's talk about primary care. In fact, over 525,000 people in rural communities do not have access to a family doctor. That is the same as the population of Newfoundland and Labrador. That number is growing by 12% each year, which means rural Ontarians are losing their doctors 4 times faster than people in urban centers. Rural property taxes. Over $461 million went to pay for health services. The rural property tax base was never intended to fund healthcare, and rural municipalities cannot be left to grapple with this on our own. The shortage of healthcare professionals is finally on the provincial radar, and we need to ensure that when decisions are being made that affect you in rural Ontario, that you have a voice. One of the recommendations to the government that the board has made is for the government to require each Ontario health team to have rural municipal representation. We have stressed the need for a collaborative, integrated health plan that provides equitable access to health services in rural Ontario. ROMA has provided 22 recommendations, well-researched and data-driven, that we believe will get the ministry moving in the right direction. During the Ministers' Forum, Minister Sylvia Jones indicated that we would be getting a Valentine's present concerning healthcare. I hope that it is good news for rural Ontario. Let's wait and see. I'd like to thank you for attending the conference and hope you were inspired by new ideas and innovative solutions to the problems we're all up against. You can follow us on Facebook, LinkedIn, and X. That's all for now. Thank you very much.